AI equals an IT problem. That is a terrible mistake to make. So AI really is not an IT problem. It really is about how it's reshaping how you do business, reshaping your profit pools, reshaping your risk.
So what does your platform actually do?
There's a growing list of AI that they want to use. There's a growing list of AI that they're building internally. Currently takes 8 months for them from initial evaluation all the way to initial implementation. Again, we take the 8-month cycle and then we turn it into about 6 weeks.
Is that like a legitimate concern, like using open source?
Try to describe it and effectively create synthetic data, something that mimics what you're looking for, but don't use your own confidential data.
Marco, thanks so much for taking the time today and joining us on the Health Tech to Care podcast.
Thank you for having me.
Yeah, for the listeners, we have Marco Smit, Chief Commercial Officer and COO of DomeLabs AI, joining us, and this which includes the Clear platform. So, Marco, let's jump right in with your background so that the listeners get a sense of who we have joining us today. So, in your career, you've worked across different parts of AI, data, regulatory strategy. You've been doing this for like over a decade, it seems. What drew you to Dome Labs originally, and why was this the right moment for you to make the move, into AI full time?
Yeah, great question. And I think when it comes to me, I had a pivotal experience when it came to the US working with Genentech on a drug called Rituxan. And Rituxan was struggling at the time. And I led the team that really turned it around from a few $100 million to $1.2 billion in 2 years. And it's now an $8 billion franchise. And that opened my eyes to the fact that in pharma and life sciences specifically, we focus so much on the innovation of science, but not so much on the science of scaling clinical impact. And so my passion has been for the last 15 plus years to do exactly that, shape the next frontier of innovation and make sure that innovation that really can benefit many patients reaches those patients, as many patients as possible. I've done this through leadership roles with innovators that have the technology potential to solve industry bottlenecks. And the most recent few, I was at CareSyntax. I was at Genentech, got recruited to CareSyntax. And at CareSyntax, I was head of AI and data. And we built great AI, but there was a massive industry bottleneck, which was take that promising AI and get it from the bench to the bedside. So the person who I replaced had actually run into the same bottleneck and started a company called Gesund AI, which was focused on AI validation. So I joined that company to drive scaling, commercialization, and we were focusing on, as you said, AI regulation, FDA clinical trials of AI, and really putting the building blocks in place for predictive AI to move from the bench to the bedside. But as you know, in the last 2-3 years, there's been a lot of other AI that's not predictive AI that has come to the forefront, GenAI and Agentic AI now. And I know the CEO of DomeLabs, Dennis Chernenke, for a few years. And I really felt this is where the big next bottleneck is. We have this massive technology potential with GenAI and Agentic AI, and it's hitting real barriers. And Dome Labs has been on the forefront of this on how to address it. The founder, Dennis, wrote the AI adoption playbook for many three-letter government agencies when he was a Presidential Innovation Fellow with the Trump or the Biden administration. I don't remember which one, or with both, I believe. And so government in some ways actually was ahead of industry. And also Dome Labs really has a footprint in regulated sectors that is unheard of for such a young startup. And so all of that felt right for me to say, let me help the company drive commercialization, drive impact, and help its customers and help patients at the end of the day.
Yeah. Wow. Yeah. I mean, you're really someone that came from the industry, it sounds like, and understood those bottlenecks firsthand. Like you're saying, in regulatory industries like pharma, life sciences, I'm sure working with drugs, even in your genetics days, helped you understand sort of like, or at least identify what are those use cases for eventual AI adoption, all the way to like working with goes into you said for validating those like AI models. So and like you said, there's so much hype right now around the use of AI from the most regulated pieces of our global economy, like defense, in the defense world, but more specifically, even like there's, a lot, everyone has the buzzwords, Gen AI, Agentic AI, like, and there's still a lot of scrutiny. It's like, is this going to help, governments and, private companies alike? So from your perspective, like, what are the biggest misconceptions you're seeing? Let's start even with healthcare and life sciences with the use of different AI, and what mistakes are those organizations making right now?
Yeah, I think there may be a few mistakes. The number one mistake is that because they think AI deals a lot with data, digital data, and a lot with software, so AI equals an IT problem. That is a terrible mistake to make. So AI really is not an IT problem. It really is about how it's reshaping how you do business, reshaping your profit pools, reshaping your risk. Everything is being reshaped. So these are business problems, not IT problems. So number one, don't think that is a narrow functional problem. See it as a more profound problem that you need to address, or an opportunity to take advantage of. Along those lines, number two, I think what we see is, particularly in pharma life sciences, just last week I was talking to a number of pharma folks, and they're like, I don't want to do Gen AI until it's absolutely safe. And so I want to wait until the conditions are right. Well, waiting is not an option. So you cannot wait. So things are happening right now. Your competition is using AI. You, of course, need to manage the risk, but you cannot wait. You need to engage. It's a contact sport. Figure out how to manage the risks, but don't wait. The third part, so the four in total. So the third part is Turing traps. Nigam Shah here at Stanford calls it Turing traps, meaning I am doing a job today. Can AI do the same job better or cheaper? I think we talked about this before this call and about in different contexts. And so that is, of course, a possibility to go. But what you really need to think about is a job is a collection of tasks for an individual. And then the second part is for the whole department. There is a job to be done. And so, how do you break down this into tasks, and how do you redesign what the department is doing based on tasks that AI can handle? AI does not think in terms of a job title, they think in terms of tasks that they can execute. How can you take advantage of that to redesign your organization for more efficiency and more productivity? That's important. So, don't just replicate what you're already doing historically. And finally, you mentioned hype. Yes, I think there is a lot of hype that agentic AI will eliminate 80% of jobs imminently. And I think I saw even earlier today, someone said AI will eliminate all software. I'm like, all right, guys, we're getting a little bit, this is a little bit Silicon Valley inside.
Yeah, yeah.
This is not how things will
I
really
think
happen.
a lot of those insights are spot on, Marco. And I love what you said about, AI doesn't think in job titles; it thinks in tasks. I think that's well said. And so you can't probably look at it with the lens of a C-suite leader looking at an org chart. Like AI is going to think differently in how it ultimately executes the work required. And so I would love to dig deeper about what you guys are building at DomeLabs with ClearPath, right? And so, because I'm sure you guys are helping organizations with ways to make AI adoption safer and faster, So what does your platform actually do, and what kind of problems does it solve for healthcare and life science organizations?
Yeah, let me give you the kind of uh, the vision statement, then a use case example, and then maybe kind of how we do that. So Dome Labs believes that the reason why so many AI projects stall is because there is actually an AI control, an enablement layer that is missing. So most organizations have a data layer, model layer, and then infrastructure and applications. We build a new AI control and enablement layer between the infrastructure and the application layer. And that is where AI implementation stalls most frequently. And we have a unified control ecosystem that integrates governance, cybersecurity, capacity building, and enterprise enablement. That's a whole lot of words. Maybe I can give you a simple use case example. We have one pharma company, and they have multiple. They have an enterprise layer, and they have multiple divisions. And what you'll see is that there is a growing list of AI that they want to use. There's a growing list of AI that they're building internally, and the CISO, the cybersecurity folks, want to make sure that it obviously doesn't introduce any risk. So they are using ClearPath and DomeLabs to effectively take this process, which currently takes 8 months for them to evaluate a new AI project, from initial evaluation all the way to initial implementation. And when it's high complexity, low complexity, it takes them 8 months to do this. So there's a massive bottleneck today already, and the growth is 50 to 100% per year. So this is only getting worse. And of course, what then happens is if it takes 8 months to review an AI project, then there's going to be shadow AI. People are going to say, like, let's go around the official approval process. Now you have more risk that you're not even aware of where your where your inventory is. So what we have at ClearPath, we build a super streamlined process. We have a triaging step in there. So there's a number one, there's a triaging step based on risk and strategic fit and other parts. Number two is we use AI so that people cannot game the system, because if someone wants a quick approval, they may pretend it's a low risk when it really is a high risk. So to get it to accelerate it. But we use AI to independently obtain data and make the assessment score. And so when there's a big discrepancy between the human assessment and the AI assessment, it will send up a red flag and say to the committee, we think there's something wrong here. Look into this deeper. But on the flip side, if it is low risk by the human assessment and low risk by the AI assessment, it now can get passed through in 2 weeks instead of 8 months. So if it's high risk, even with everything that we're doing, partially because we also make it easier for the different departments to provide inputs asynchronously. So again, we take the 8 month cycle and then we turn it into about 6 weeks. So that's one of the ways in which we help make this happen. Now, how do we do that? For now, we have 3 layers. One is the governance and control layer that we call that. So that's about intake and inventory management, that's what the example I just gave you. Then there's the monitoring, we call model ops. So this is where more what Gesund AI used to do is it has the model been built in the best using the best practices? Is it compliant? Are there problems with the performance in certain populations, etc.? And then the third part is the strategy of portfolio management. Are we getting redundant AI, or are we having AI gaps? So how do we optimize the portfolio? So that is the AI governance and control layer. Then we have an enablement layer, which is training and credentialing. It is enterprise transformation, so that's change management. And then human AI layered workflow enablement. So that's the second layer for enablement. And the third is a marketplace where we will introduce what do you call that? Vetted vendors, vetted AI models and applications and vendors to the customer base as well.
Wow. I mean, so you guys are really covering the end to end, let's call it AI workflow almost, It's all the way from governance to even picking a new vetted AI vendor. And I want to go back to something you said, which I loved, which is like the fact that you guys can use AI to, create assessments, like independent assessments, but also compare it to human ones and see if there's variance. Cause I think that's like maybe like I don't know if the word is fear, but a lot of CISOs and I'm sure IT security leaders out there like have realized that these models like can create bias if you're just training it on data from your organization and what they use. Let's pick a pharma company and what their staff is using day to day. It's going to be biased to what they want it to do. So the fact that you guys are able to pull independent data and compare it to that, I'm sure is valuable to those type of leaders.
Yeah, absolutely. And I think even for the folks who are building the AI, to some extent, to your point, maybe they can get away with some bias in some situations. But number one, you don't want to have bias because it's going to be exposed at some point. So you're better off catching it early and fixing it
Right.
early. And second, we do also have our user community is called Valid AI. And Valid AI is about 60, or I think by now 80 health systems. And it's typically the C suite who will give us feedback about what AI they are looking at or considering and what issues they are facing, etc. So we also build intelligence around what works, what doesn't work, what is on people's minds, and so we can kind of help you not just be reactive, but also stay ahead of the market and figure out, am I out of sync or in sync with what's happening in the market?
Yeah, spot on. Yeah, because I'm sure there's so many like let's call them AI based projects that don't end up materializing. So what was that evaluation criteria? Why did another C-suite member not decide to move forward at something? If you could have your that data at your those insights at your fingertips, I'm
Yeah.
sure it helps you create better results out of it. And on that point, what does it really require from a governance or a governance control perspective in, like, let's pick pharma since we've been talking about that. What's required to generate results long term, especially for regulated organizations that have to follow a lot of um checkpoints along the way for risk compliance, control over AI usage. Like what's really required from an AI governance perspective in your eyes to get those long-term results?
Yeah. So I think there are three or four things that you should be doing. So I think, obviously, and I say this a bit self-serving, the first thing you should do is call us with Dome Lab. So, and I'm not, I'm half joking. The fact of the matter is, what we do, there is not that much out there on the market. So there are point solutions out there, and that's hard to put point solutions together. But okay, other than us, I think a bigger picture. Number one, the point that I mentioned earlier, acknowledge how profound the change is going to be. And what I mean with that in this case specifically is we understand that your organization today was optimized for a legacy situation. The new situation that's AI enabled or AI empowered is probably going to be different. So, what that means is, number one, you need to be aware of this and start working on how will that change. Number two, you need to start set up missing roles to help manage the transition. So one of the things that we typically talk about is AI success directors, AI use case managers. Those are roles that do not exist in most organizations today, but that are actually important to bridge where you are today versus where you need to be tomorrow. Because you can't just, in healthcare and final life sciences, many innovators always talk, today's situation is broken, this is the end state that we're going to. What they forget is the transition in between. And that's
Mm,
where most of these projects fail, right? So you do proactively need to acknowledge it's not going to be easy to go from where we are today to the destination. So let's actively manage that. So appoint an AI success director, appoint AI use case managers. And the final part is, I think you need to leave your comfort zone. And I was just earlier, or at least for last week, I was talking to some folks, and they're like, "Well, regulatory this, regulatory that," and you can't. The fact of the matter is, regulatory clarity is lacking today. I was talking to someone from a large academic medical center, and it's like, well, AI scribes, when do they become a medical device? When are they not? What if they recommend that I take this drug or recommend that I take that test?
mm,
Are they now a device? The fact of the matter is you cannot wait for regulatory clarity. What you can do is do two things. Number one is build audit trails in whatever you're building, doing, whatever you're deciding, and document your compliance as best you can so that when the clarity becomes there, you can say, now I can look back at the data. We have a history in healthcare and life science of saying, tell me what the problem is, and then I'll look if I have the data. You cannot,
mm,
you have to go the other way around. I'll create all the data that no matter how you want to look at it, I will have the data to demonstrate where compliance is. I demonstrate that I did my best given the uncertainty, and now we can work on a path to become compliant. So if there are any gaps remaining. So those are the things that I would say, do that right now, and don't wait, and this will be your best protection.
yeah, yeah, spot on. And you said the two magic words earlier, which is change management. Like so much of AI, I think, is you can have the buy-in of the C-suite leader you're working with, but the organization needs to come on board too, right? And so when you talked about setting up missing roles to manage, let's say, transitions or adoptions of AI projects, that's super interesting to me, because I've been even seeing in my own line of work and in healthcare, like these AI director positions are popping up more and more, but it's like they need a team underneath them. You can't just have one figurehead for AI in your organization. You need the people below to, like you said, the use case managers to support the use cases your organization ends up adopting. And now, are those out of curiosity? Are those roles, have you found in your guys' work that leaders can like upskill their existing workforce, like someone like in the organization becomes the use case manager, the AI success director, or do you guys often find yourselves helping them go recruit that from the industry, recruit those people from the industry?
Yeah, it's a great question. And I think this is where there's a huge unmet need at this point in the market, which is that, and this often happens in transition times, but the word upskilling is in incredible demand right now,
Mm-hmm.
and for good reasons. And we are part of executive network on the defense side. And even there, they say we do not have enough folks who understand both cybersecurity and AI and the clinical side of things, if there's a clinical angle or whatever the angle is specifically. So we do not have folks with all the required expertise. And there is currently, I'd say, the credentialing and training that's happening is just for the super C suite, right? You go to Stanford, Harvard, they all have programs for 8,000, 15,000, etc. So that's great, but I think we need to go for the level below
Mm-hmm.
and we need to make it more accessible, right? But even we see, for example, folks get, let's say if you're an oncologist or a surgeon and you get put on the AI governance committee, what do you know exactly about AI, right? So we what we do is we provide a combination of training and credentialing, and also we will build agents to do some of the legwork. Because the other part too is there's the skill, knowing what questions to ask, knowing how to evaluate information, and then there's the actually pulling in all the data and all the information, organizing it the right way. So we can make the agents do a lot of that legwork and saying, here's what we would propose because these are it's complying with NIST, it's complying with this framework, etc. And ultimately, the human in the loop will still make the decision, but now their life has been made a lot easier. So that's one thing that we do as well. So there is a gap in the market. I'm sure companies will start stepping into it, but I think the space is moving too fast at this point for larger incumbents to provide solutions. So we do it for our clients and for the Valid AI members, but there's definitely an unmet need out there for sure.
Yeah, yeah, well said. It's almost like there's a transition before the transition for their organization. Like I can see different organizations partnering with companies like Dome Labs, right, to fill in some of the training credentialing needs that they need before they get ready to, okay, now we know what we want to start building. Let's go, either upskill our own people or go hire like a AI use case manager, like you call their AI success director. Like you guys can fill in some of these things that they need now, and then when they get ready, um, you guys also understand those steps that are required to go hire or upskill someone,
Yeah,
or several,
absolutely.
not just someone, several people often. Um,
Yeah.
yeah. And on that same vein, I think there's a lot of worried folks out there. There's a sense of fear from AI projects potentially taking people's job. Like they see a AI use case manager come, like a title pop up in their workday or whatever, HR software they use. Like you get concerned, right? As like the worker of that organization, and as much as CEOs and other C suites are excited about the potential of AI, some people are fearful of that or worried about it. So how real of a threat is that part specifically, and what should employees do to deal with that if their organization is, let's call it AI positive or AI like enthusiast, and
Yeah.
how real is the threat and what should they do to deal with that if you're an employee of an organization?
Yeah. So I think what we were talking about earlier in terms of AI, thinking in terms of tasks. So I think what you should really do is, so number one, yes, there is definitely a threat that certain type of tasks are going to be very suitable for AI replacement. So I give you an example. When I was at Roche, we had one person whose role it was to collect biomarker data from various trials from various sites, and I would say 60 to 70% of her time was just collecting the data, aggregating it, etc., and organizing it before doing any analysis. Well, that 60 to 70%, most likely AI can start doing a whole lot of that very soon. So there are parts of your
Mhm.
job that you should think about what is really suitable for AI, and you should count on it in the next 1 to 2 years. AI will start doing those jobs. Well, now where the upside is to say, okay, I wasn't exactly enjoying wrangling all that data in the first place, right? So I wanted to get to more high value activities, but I couldn't because I was bogged down in these lower value activities. So see this as an opportunity to say, now what can I do that I could not do before, right? So number one, be aware of what tasks of your job are going to be susceptible to AI. Number two, start thinking about what is our high value added activity task that I could take on that I couldn't was impeded from taking on because I was bogged down in this manual work. And then I think number three is there is time. I know that people think that AI agents are going to take over all their jobs. The fact of the matter is that if we build an agent for all the jobs and all the tasks that exist today, we would need roughly 10 to 100 times as much power as our grid can produce today. We're not going to produce 100 times as much power in the next 2 years or 3 years. So this is where your opportunity is to say, if the change is happening in the next, let's call it 2 to 3 years, then how am I going to ride that wave of change? How am I going to be on top of that wave of change instead of letting it come over me as a tsunami? That is where your opportunity is. Figuring, understand what's happening in AI, how can I turn this threat into an opportunity, and what is out there in my field. I think there's something called Science 42, which does in medical affairs. They pull the data in, they draft your paper, they do citations. These are all manual tasks that you are losing a lot of time on, and they'll automate all of that with backlinks and everything. So okay, so if that's freed up, then my role is more asking the right question, designing the right experiment, et cetera, right?
Right.
So that's how you need to think about how do I shift from what I was doing to what I'm going to be doing.
Yeah. Yeah. Well said. It's almost, you know what it kind of reminds me of is it's, if you're an employee of a large organization, it's like a new form of managing upwards, you know? It's like identifying where, like, okay, it's like having self-awareness of like, these are the tasks, like you said, the example at Roche, like these are this thing, like collecting, organizing data takes up 60-75% of my time. Let me go to my director, whoever the AI leader is in the organization, and like submit this almost as a use case and be like, look, like these are the areas I'm really good at. This is where you need a human in the loop like me, like you said, designing the right experiments, ask like where do we ask the right questions in the study, or like what are the questions to ask. But these are the things, like it's almost like you become like a submitter of AI use cases to whoever that leader is. And I know earlier you were talking about valid AI and how you guys are building intelligence across health systems. Wouldn't it be nice if you could also have intelligence on the types of use cases, not just like C-suite leaders are submitting, but their own employees? You know, like this is
Yeah.
what we're seeing across the industry or across workforces. Like these are the types of things that are being asked for. This is what's being declined for X reason, or this is what's being approved because it's taking up 60-75% of these resources time. You know, like I think
Yeah.
intelligence can go both ways. So
Yeah, and I
uh,
think even to your point is it's also good when let's say a company just like yours was trying to solve the problem by using this AI tool, and it turned out to not work out at all, right? Rather than you repeating the same mistake, you'd want to learn from that and say what was specific to you versus what's actually due to the tool, or and how do we then improve that, and then from your experience, you can basically share back to the other company, like or the health system, hey, this is a way in which we can salvage your situation. So there's definitely, I think this is one of the hard parts about healthcare and life sciences, partially because we're so confidential. everyone goes up the learning curve by themselves. And so, whereas in many other industries, there's a collective going up the learning curve and we all share. But in our
Mhm.
industry, sharing is we're so resistant to sharing that we just go up the learning curve so much slower because we go off it so many more times compared to the other industries. So,
Yeah, or maybe the health system leaders as part of your valid AI group. May beg to differ on that point, but I hear you.
correct.
Like there
Yes.
could be more done. Um, and so I want to talk to you about a separate but related topic, which is the buzzword open source. I think there's a lot of reluctancy for companies to allow, employees to use open source AI at work, or even like use of shadow AI, like you said earlier, especially when you're dealing with proprietary information, whether that's PHI, PAI data with patients. Is that like a legitimate concern, like using open source and AI at work? And how do you recommend dealing with this? If you're a company leader, and because there are a lot of open source tools available in the market that employees can start to use, and then they spin up some type of shadow AI use case, just because it's available. I
Yeah.
used a company card and my manager approved it, and it's like, well, so is that a concern for the types of C-suite leaders you're talking to, and how do you recommend they deal with it?
Yeah, absolutely. I think there are two or three comments. Number one is this is one of their first concerns is that they don't even know what AI is actually being used in their organization. So they get very nervous that, to your point, it's two, three people who, or maybe even if the AI, because a lot of these AI, new AI solutions to gain footprint, they really lower their price, right? Or they're near free or anything like that. So there is nothing that stops this individual user from adopting that AI and not seeking central approval. And then maybe even say like, well, let me try it out for a while. And if I really am going to keep using it, then I'll flag it. But if I abandon it, then I'll why bother go through the whole process? So that's definitely a serious concern for the C-suite. I think so. That's where we come in with ClearPath. We really help track and manage all of that, and then appropriately kind of do risk assessment so that not everything. You don't need a sledgehammer for every single thing, right? So you need to also say what is the appropriate level of evaluation. The one other part too that's kind of related to this, adjacent to this, is we have so many pharma company folks who say like, well, if I could, should I put my proprietary data into JetGPT or Gemini or any one of those models because they say we have an enterprise license and it's not truly open source. It's kind of sort of open source, but not really. I'm like,
Hmm.
yeah, well, we've seen it now many times over. They will change their terms of service overnight at some undetermined point in the future. And at that point, your data is already in there. There's nothing you can do to pull it out. And I can tell you at DomeLabs, I can tell you at many government agencies, the people who are inside of these organizations, they don't believe that you should be putting any confidential information in there.
Hmm.
So I would certainly recommend if you are trying to get specificity of an answer, because you don't want to, that's why the reason why you want to upload confidential data, try to describe it and effectively create synthetic data, something that mimics what you're looking for, but don't use your own confidential data. So mimic the situation that you have. That's going to take energy, but do create dummy data that just resembles your situation and try to use that. Then it's safe. It's not, there's no confidential data that's being leaked or later on being used for training, even though originally it wasn't said it was going to be used for training. But you're still going to get your specific answer on like, is this significant or not, or something like that, right? So
Right.
that's what I would recommend on that.
That's a good recommendation. Yeah, it's almost like we're going back to the days of like when employees were told don't use your personal laptop for work. It's kind of like don't use your open source AI for work. It's like
Yeah.
do not put our company information in that. Like, and because I was going to ask you, I mean, are there like certain pockets of the work that you guys are seeing with AI like that where these open source tools are acceptable? And I think you answered it. It's like use it as to when you want specificity in your answer is like create like a synthetic data set, and mimic what you're trying to do, but don't feed it the actual data that you're dealing with.
Yeah.
And I think
That's
that's
the
the
best you
answer,
can
right?
do. Yeah, that's the best of both worlds. You still get your specific answer, but you don't expose your own confidential data. So
Right.
so you just have to be careful.
Yeah, that's when like a company would like lean into their own like AI model that they spin up with your guys' help, or does it really depend
Yeah,
on the use case?
but and
Okay.
then I think this is also where you if you have use case managers can help you with this particular type of problem. Like, I want to get an answer to this very specific question that I have, but I don't want to expose my confidential data. How would you help me craft this prompt or context?
Yeah, makes sense. Okay, and then they're able to go to that as that person as a resource versus like another AI, like open source AI, or an AI agent that they developed on the side. Yeah, no, because
That's
you hear
true.
about it. I mean, like a lot of organizations even have like Microsoft Copilot. Like a lot of employees have that, and they can create AI, assisted workflows, right? Or even
Yeah,
set up an agentic like agent to do tasks, and it's like and yes, like some of that might be on enterprise licensure, like you said, but you have to be careful about what type of specific confidential or PII, PHI data that you upload onto those open source models. So makes a
yeah,
lot of sense.
absolutely.
Yeah, and so I think we covered a lot on this podcast. But where can people go to learn more? About Dome Labs. See how your platform ClearPath works, and or connect on any of the specific topics we raised, from governance monitoring to AI portfolio management to finding new AI vendors. Like where how can they connect with you guys and explore a potential collaboration?
Yeah, so I think there are a couple of ways. Obviously, you can reach out, go to our website, domelabs.ai. That's one place to go. You can reach me on LinkedIn, Marco Smit. The other part too is we will be at the Stanford AI Week, which is, I think, the last week of May or the first week of June. So that's coming up pretty soon as well. And you can reach out to me at marco@domelabs.ai as well. But those are the places to reach for now. We have been very stealthy for a long time. We are going to be more open to the public, I'd say in Q2 of 2026. So we will start more talking about ClearPath. We'll make some use cases or case studies available. We'll start doing some videos and webinars. So that will all start coming up in Q2 of this year.
Yeah, right on. All right, so it sounds like this podcast was timely ahead of the Q2 push, and we'll make sure to link your LinkedIn for sure and the website in the comments below for folks to connect with you. And any of those out on the West Coast or flying in for the AI week at Stanford, we'll make sure to call that out as well. So
Sounds good.
Marco, yeah, it's been a pleasure speaking to you today, and yeah, cheering on the Dome Labs team from the sidelines. I'm sure there's a plethora of work, not just in healthcare life sciences, but also the defense space with the big announcement, most recently about OpenAI, with the U.S. Defense and the Pentagon team. So I'm sure there's a lot of work coming your guys' way and a lot of opportunity to help organizations with this and companies that are on different stages of their maturity. Some early adopters, some like we have no idea. One, and we're a team. I'm a team of one that's like pushing AI adoption in my organization. I'm sure you've seen the different versions of that. So yeah, pleasure speaking to you today, and thanks for making the time to educate us on this important topic that I think a year or two from now, looking back, we'll probably be like, "That's all you guys knew about AI." We'll be looking back at this podcast in a year or two, thinking, we knew so little. So appreciate your time today, and yeah, I'm sure the audience will enjoy listening to this one.
Yeah, thank you for having me, and thank you for also doing the podcast and helping your audience learn about this. This is very important, and we are really kind of at the tip of the spear. And I think, to your point, I think we're in the second or third inning for AI, so there's still a long way to go. So exactly to your point, by the time we get to the sixth or seventh inning, we're like, oh my god, we thought it was so important, and we're just getting started. So there's a lot of
Right.
excitement still ahead of us.
Yeah, most definitely. I'm excited for those innings coming up. I think there'll be more than just AI use case managers in the future. So the
Yeah,
possibilities are
absolutely.
endless, and it's like you said, I think like inaction is the worst thing you can do right now. It's like it's, what did you call it? It was like it's not a battle. You used a word on this podcast, which I loved. You called it, combat. It's like open combat, it's like a game of combat. And you got to join, you got to step into the ring or you're going to be left behind.
That's
So,
right. Yes.
yeah. All right. And I think we can end on that. But yeah, Marco, it's a pleasure speaking to you. And yeah, more to follow on this very important topic.
Yeah. Thank you.
Yeah.
Likewise.
All right. Have a good one. Bye bye.
All right. Thanks. Bye.